Hey everyone, it's Faheem, pharmacist, prescriber, contractor, founder of Medlearn. In this video, we are going to be going through the requirements to become a non-medical prescriber. I want you guys to subscribe, like, and share to the channel. I need you guys to focus because today I'm going to break down everything that you need to know so you can be the best version of yourself and build a better world. So join me, get your coffee, and let's together enjoy the time that we're going to be spending. Come on, follow me, folks. Let's make it happen. So for those of you guys who are subscribing, liking and sharing and commenting, I want to give you a big thank you because it makes a difference. And we've got a comment from one of our followers who's asked, what are the requirements to become a non-medical prescriber? And my colleague had just decided to play the shredder. I don't know why. So I do apologize if that noise is coming in. And he's continually playing the shredder. Krishna, why are you playing the shredder? Why are you pressing the shredder? You should say sorry. And now look, he's shying for the camera. I don't know why he's shying for the camera, but we're going to stop him from doing that because there's no need for that. Anyway, let's bring it back to where we were. The requirements to become a non-medical prescriber. This is for pharmacists. If you're nurses and you're listening to this, we are going to be making a separate video for nurses, but this is for pharmacists. As you know, I've got my best friend here, and that is this paper. And my brother, my colleague Farouk, who's shooting this video, I love you, bro, because if it wasn't for you, then none of this would be possible. So yeah, we can make a heart and give it to him. But anyway, let's get to the point. So what we're going to do is we're going to break this video down into a pathway that you need to keep in mind. I'm then going to explain to you about the must or the mandatory that has to be in place to become a non-medical prescriber. And then I'm going to talk about desirable. So let me explain again. We're going to discuss this pathway, or we're going to talk about the non-medical prescribing course. We're then going to talk about, or probably initially talk about the must, which are like the mandatory requirements, and then what's desirable for you to get the best out of your course. This is something that's very important to understand. Irrespective of gaining your qualification, ultimately the key thing has to be, what is the outcome? What is the outcome? What is the outcome? So if you gain a qualification and you can't utilize it, what's the point? It's the same thing with exercise, and something that one of my colleagues at the gym explained to me, that there's no point having big muscles and being strong if you can't utilize that strength. Having big muscles and lacking power and lacking strength is pointless, because what's the point of that body unless it's aesthetics that you want? Same thing with non-medical prescribing. The point is, if you've got a qualification but you can't utilize it, or you don't feel comfortable prescribing for a wide range of conditions, then that qualification is not worth the paper that it's written on. So that's why I want to explain to you not only how to get onto the course, but how you get the best out of the course. So that's important to remember. So let's talk about some mandatory. What are the requirements from GPAC? So the first thing is that you need to be a registered pharmacist. That's the first thing. So you go to university, you gain your qualification, you pass your pre-reg, and now you're a registered pharmacist. That's the first thing. The second thing that they would like you to have, because the law has changed now, is they would like you to have some relevant experience within your chosen area that you're going to be prescribing in. Let me explain something. When you gain your prescribing qualification, it is true by law, you can prescribe practically any condition. But the caveat is that you need to be competent within that area. That's the key thing to remember. So for example, let's say I gained my prescribing qualification and I trained in hypertension. I would not want to prescribe in diabetes because I don't have the competence in diabetes. By law I could, but should I? Probably the answer to that is no. It's the same thing like dentists. We know that when dentists prescribe something like, let's say, atenolol, you would certainly question it that, hold on, you're a dentist, you specialize in head and neck, you specialize in dentistry, why would you be prescribing for the heart? It's the same thing for a pharmacist prescriber. Now, having said that, it is possible and it's doable that you can develop your competencies. And how I was explaining this is, imagine you have a box. So within this box here, this is a little box that I'm in. So this is the box in which I will do my prescribing initially. But that box can expand. We can make that box a bit bigger. So we choose on other disease states. So we get a bigger box and a bigger box. And before you know it, you can prescribe for a wide range of conditions. So that's important to remember. Really important to remember. But initially what you have to do is you've got to be qualified as a pharmacist, number one. Number two, you have to have an area that you have relevant experience in. That's the key thing, because the universities, when you apply, would like you to demonstrate that you do have a clinical area that you are already playing a role in managing the patient. Now, I get a lot of pharmacists say to me, could I prescribe for hypertension in community pharmacy? My question to you is, can you diagnose, manage, treat that patient hand on heart? Ask yourself, do you know the incidents about the disease, like hypertension, the etiology, how geography affects it? What about sex? What about pathology, microscopic, macroscopic? What about signs, symptoms? What about diagnosis, treatment and management? Do you know this condition that well? If it's hypertension, are you able to take a patient who may have hypertension, take them on a journey from start to finish? Are you playing a role in their biochemistry results? Are you playing a role to identify end organ damage? Are you then playing a role in not prescribing but advising to write a prescription and then reviewing that patient? If you're doing this in a community pharmacy, then absolutely you can do hypertension. If you're not doing that, then you might want to think about other conditions that you are doing. For example, ear, nose and throat. You are playing a role in managing tonsillitis because you can prescribe or sell Diflam. You are playing a role in ears anyway because you can give potentially ear calm spray. So you can see that ear, nose and throat might be something that you have more experience in as opposed to hypertension. Same thing with diabetes. It's not that you're not competent. It's not that you can't gain the competency, but it depends on where you're working. To diagnose diabetes, it's not just a case of your sugar levels are high. There's a lot that goes behind the scene. And we are going to be doing specialist clinical topics for pharmacists on how to diagnose and treat a wide range of conditions. So when you're choosing your clinical area, ask yourself, can I actually diagnose this condition? Have I been involved in that patient care from start to finish? And it doesn't mean writing a prescription. It could be that you make a recommendation to the doctor that this patient has a UTI, please can you prescribe nitrofurantoin? This patient has an earache, please can you prescribe Automized? This patient has a sore throat, I've diagnosed, I've had a look, it's tonsillitis, can you prescribe something like phenoxymethyl-penicillin? CPCS is another opportunity for you to gain this experience. So when you decide to choose your clinical area, hand on heart, ask yourself, do you have that experience? And it's not just a case of something you want to do and you like to do. It's something that you need to have experience in, because the universities will expect you to demonstrate this. They would require you to have references. They will require you to have CPDs in place to prove that you have that area. So first of all, you're going to be a registered pharmacist. Secondly, you're going to choose a clinical area that you are already managing and diagnosing. I would say for pharmacists and community pharmacy, stick with ear, nose and throat, and then stick with maybe dermatology. That would be a good start. If you want to do chronic, you can, but think about playing a role in that entire area. That's one thing to remember. If you're unsure, my contact number is there, our email is there, get in touch with us, we can advise you. That's two things that are important there. Now, having said that, when you qualify, you are able to prescribe in other conditions once you're competent. And competency is different to having qualification. Competency is all about having the skill set, having the experience, and how you become competent is by practice. So let's say I gained my prescribing qualification in hypertension and I wanted to do diabetes. What do I need to do? Learn the disease state inside out. Then I need to observe someone who's an expert in diabetes. Then I need them to observe me. Then I need to be treating the patients, and then I need to be signed off by a supervisor that I'm competent. That's how you gain competency. You don't need to get another qualification. Having said that, if you had a qualification, it would be good, but you need experience. So that's why you can then do diabetes, you can do cholesterol, you can do hypertension, you can do minor illnesses. And if you're struggling with this, get in touch with us. We can help you gain your competencies. So that was a bit about that. So number one, you're a registered pharmacist. Number two, you have the clinical experience that you need and you've chosen an area. And when you're choosing an area, make sure it's quite defined. So if it's hypertension, you might want to say diagnosis and management of hypertension in adults stages 1, 2 and 3 with no comorbidities. Diagnosis and management of UTIs in women aged 16 years to 65 with no comorbidities and systemically well, for example. For a sore throat, something similar. So you want to choose a narrow scope to make it easier for you. Once you've done that, you also need to have someone who has experience in teaching, who has the clinical knowledge and is prescribing to teach you in your clinical area. This is what we call a DPP. used to formerly be known as a designated medical practitioner, DMP, but now it's a DPP. So this should be a prescriber with at least 3 years post-prescribing experience and have teaching experience. I get pharmacists say, I've got a friend who's a pharmacist prescriber, can he be a DPP? Ask him, has he taught before, or her? Have they taught before? Do they have the clinical experience, and are they prescribing? Do they have the clinical knowledge? Have they delivered or acted as a DMP or DPP before? These are the questions I have. And also ask them, are they going to support me afterwards? Because the universities will require 90 hours of supervision. And in my opinion, 90 hours is not enough for you to become safe at prescribing. So before you go ahead and choose someone, ask them, wait a second, have you done this before? Have you helped a pharmacist before? Do you have the clinical knowledge? What experience do you have? And are you going to support me afterwards? Personally, in my opinion, irrespective of who it is, I would make sure that the person who's going to teach you has those or ticks those boxes. And doctors, probably your best place, because that's what they do day in, day out. It's like if you want to learn to drive a Ferrari, you want to go to someone who drives a Ferrari all the time. And that might be a Formula One, or not Ferrari, a Formula One car, for example. Driving a Ferrari is not difficult, but a Formula One car. You want to go with a Formula One expert, not with someone who's driving a bus. Same thing with prescribing. That's what doctors do day in, day out. That's their job. That's what they qualify to do. Pharmacist prescriber, nurse prescribers certainly have a role to play, but not every pharmacist prescriber, not every nurse prescriber will have the clinical competency to be able to teach you a wide range of conditions, simply because they don't have that relevant experience or training. But I'm sure with time, eventually, this non-medical prescribing qualification and the future students are going to be at a higher level. And remember, non-medical prescribing course is not there to replace doctors, it's there to support and augment. Keep that in mind. So we've spoken about having relevant experience. We've spoken about becoming or getting in touch or having a DPP in place. We've spoken about making sure you're registered. Now, these are mandatory, that has to be in place. 3 things. You're a qualified pharmacist, you have a DPP in place, and you have experience, must-haves. Then what happens, what you have to do? The next step would be, if you've got them in place, is choosing a university. You need to choose a university. Various universities offering a course. Make sure you visit the GPHC website and you check that the course is accredited. I would also recommend having a look at the HEE website to see which courses are offered through HEE, so you don't have to pay for those courses. University courses can range anywhere from £2,000 to £3,000, and HEE are funding those courses, but it's not every university. There's a list, and we'll leave it in the link that you can click on to see who are receiving funding. When you choose a university, I would recommend, think about if you've been to that university before. That's going to be first, because you'll already have an experience with the teaching, whether you liked it or not. Number 2, think about distance, think about cost, and think about the mode of study. Are they offering an online course? Are they offering a face-to-face course? Are they offering a hybrid model? I think this course can be delivered safely online, as long as your DMP and DPP is teaching you the skill set. It saves time, it saves money, and it saves holidays, so you don't have to book off more holidays. So maybe online is good. At the top of my head, online, Salford were offering an online course, Bath were offering an online course, Robert Gordon University were offering an online course. And double check this, I think University of West England, UWE, I think were also Bristol, were offering an online course, but double check this. So that's how I would choose the university. Then you've got to find a DMP or DPP, and that's where most pharmacists get stuck. Because finding someone might not be difficult. It's like choosing a wife, right? Or a husband. It's not just about finding someone that's got a pulse, okay? And I'm being very crude about this, but you want to spend your life with that person. So I'm not saying that you're going to spend your life with that doctor, but you need to be making sure that this DMP or DPP is going to support you from start to finish. Not just while you're on your course, but afterwards are they there for you? Because if you're a community pharmacist or you're working general practice, you would need to make sure that this person is there to support you, because you're on a journey. And when you're on a journey, that means that you're going to move forward and you're going to move back, but the direction is always forward. So you need someone to handhold you and support you. Just think about your time when you qualified as a pharmacist. When you qualified as a pharmacist, initially you needed that support from your supervisor, your pre-reg tutor. So make sure that don't just find a DMP or DPP, make sure this doctor or this pharmacist, whoever's going to train you and you felt it's safe to do so, is going to support you afterwards. If you're struggling to find a DPP, get in touch with us at MedLearn. We are more than happy to help you and support you through that. So that's going to be important for you to remember. So now we've done this, let's see what we've got left. Some universities also require you to have a DSP, a designated supervising practitioner. You can think of this as you have your DPP, for example, your doctor, and the DSP might be a nurse or a pharmacist or another doctor, like your supervisor. Not every university requires this, some universities require this as well. So not only do you have a doctor, but you also have a designated supervising practitioner who's there for you on a daily basis. And again, they should have suitable experience, they should understand the requirements from university. That's important as well. So you might require that. I know, for example, UWE definitely require it, and some other universities are doing it as well. And for nurses, it's pretty much mandatory. Keep that in mind. Okay, with that being said, you then also need to train clinically. So it's going to be important that wherever you're getting your training, that they teach you how to diagnose, manage, and treat disease from start to finish. That's going to be important. Making sure that when you're spending time with your supervisor, you're observing, you're also getting hands-on experience, you're also discussing case-based discussions, you're also learning how to examine. So you should learn how to examine every body system, from the respiratory to cardiovascular, all the way to MSK, to the neuro exam and abdomen. Make sure you're learning that. Make sure you're learning basic skills like using an otoscope, a stethoscope, and so on. So that's going to be important, training clinically. And we're going to be talking about this in a lot of depth, about training clinically, in future videos, so don't worry about it too much. And then postgraduate support. This is important, making sure that you have postgraduate support. It's not just about qualifying, it's about someone hand-holding you on that journey so you can utilize your qualification. And that's what I call postgraduate support. Make sure you have that. That's important for you to remember. Now, some desirable skills that I think should be there. Number one is you should already have skills in diagnosing, managing, and treating. You should know how you take a history. You should know how you examine a patient, because the university courses are not there to teach you clinical skills. You need to already have this skill set in place. So make sure that you can take a thorough history. Make sure you can examine a patient. This will help you immensely, believe me. In terms of your therapeutic area, ask yourself, do you know the incidents about the area itself, how age affects it, how sex affects it, etiology, geography, pathology, microscopic, macroscopic, signs, symptom, diagnosis, treatment, and guidelines. As long as you know all of this for your condition, you're good to go and you have the experience. Universities will also require you to write at level 7. So desirable would also be some sort of critical reflecting skills, critical writing skills, or writing at level 7. Again, very, very important to make sure that you're able to write at level 7. That's important. And then some sort of plan and structure in place. I would recommend that you should have some sort of plan, some sort of structure in place to help you through the course. For example, there should be an initial meeting with your doctor. Afterwards, there should be regular, what we call meetings to make sure you're doing well. There should be objectives in place that should be smart. All of this needs to be in place. Do not just go there and just sit with your doctor and spend time. Have a structure in place. Week 1, there'll be an introduction. Week 2, we'll focus on history taking. Week 3, we'll talk about physical examination skills. Week 4, we'll talk about how to diagnose a patient and actually see patients. Week 5, we'll do X, Y, Z. Week 7, or 6 and 7, we'll talk about case-based discussions and so on. So that's important. Having your plan in place is very, very important. So to overall summarize, the non-medical prescribing course requirements. You need to be registered pharmacist, you need to have a DPP in place, you need to have chosen and clinical area. The university course must be accredited by the GPAC. Think about HE funding and think wisely about who should be there supporting you through your journey. As always, subscribe, like and share. Together, let's build a better world. Thank you for watching and good luck with your journey. Thank you.